All right. Hi, everyone. It's the top of the hour, so we are going to get today's session started. I know there are a few more of you still coming into the room, but we'll go ahead and get going. Thanks so much for coming to Casting a Wide Net, Combating Health Misinformation in Alaska. My name is Erica Lake, and I'm the Medical and Academic Library Outreach Coordinator for Region 6 of the Network of the National Library of Medicine, and I'm going to be your host for today's session. Got just a couple of informational items to cover before we get into our presentation. Everyone has been muted to limit background noise, but we do welcome your comments and your questions at any time. Please use the chat function to share your comments and use the Q&A function to submit any questions you have for our speakers. Miles Dietz-Castell from Region 6 is providing technical assistance today, and he's going to be keeping an eye on your post with me. We'll queue up your questions as they come in and save them for our speakers to address at the end of their presentation. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct to foster a respectful and professional learning environment. We do have closed caption enabled today, and that's available by clicking on the icon with the 3 dots and then selecting closed caption. And we are recording today's presentation, and we will post it on NNLM's YouTube channel in 1 to 2 weeks. At that time, everyone who registered for this session will receive an email from us with a link for the recording, so keep an eye out for that. This webinar is eligible for 1 Medical Library Association continuing education credit, which you'll be able to claim through the evaluation link we share with you at the end of the session. And speaking of that evaluation, your feedback really matters and it helps us improve future training. So please take a moment to complete it. Since some of you might be first-time attendees to one of our webinars, I'd like to share just a couple of words about who we are. NLM, the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the Network of the National Library of Medicine, is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. If you'd like to connect with your regional medical library or learn how to become a network member, you can check out our website at nnlm.gov. Today's session is part of our Health Misinformation webinar series. This series features presentations from expert guest speakers and will enable librarians, public health professionals, health educators, and healthcare providers to explore various aspects of health misinformation, disinformation, and malinformation, and learn practical and evidence-based solutions for how to identify it and help curb its spread. These presentations will be scheduled intermittently throughout the rest of the year, and you can learn about upcoming sessions by checking out the NNLM training calendar or by following your regional medical library's newsletters and blog posts. All right, it's my great pleasure to introduce our 2 speakers for today's session. Anna Bjartsmardsdottir is an associate professor and allied and public health librarian for the Alaska Medical Library at Consortium Library for University of Alaska Anchorage and Alaska Pacific University. And Jennifer McKay is the nursing librarian at University of Alaska Anchorage and newly head of the Alaska Medical Library at Consortia Library for University of Alaska Anchorage and Alaska Pacific University. Welcome to both of you. I am going to turn off my camera now and I'll turn this session over to you.
Oops. Thank you very much. I'm going to share my screen here. One moment. Okay. And minimize here so I can see. Let's start the slideshow. Let's see. Okay. Well, welcome to Casting a Wide Net, Combating Health Misinformation in Alaska. We're going to talk today a little bit about a grant-funded project that we were a part of that dealt with combating health misinformation, and how this project also fits into other work that we do, and basically how that all fits into the state of Alaska. So going to forward here. My name is Anna Bjartmarsdottir, Public and Allied Health Librarian, and my colleague Jennifer McKay, Nursing Librarian and Head of the Alaska Medical Library. We are both here to present this for you today. We're going to go over a few different topics. So briefly, we're going to give you some demographics connected to state of Alaska and the University of Alaska Anchorage in particular, where this project came out of, and then talk about the medical library and their partners, and move into the grant project that we're talking about here today, and how that all played out. And then at the very end, we'll leave some time for questions. Hey, Jennifer.
Hi, everyone. I'm Jennifer McKay. I'm the nursing and head of the Alaska Medical Library. And I just wanted to talk briefly. We all know kind of the size of Alaska, but I think this slide really puts it in perspective as far as where it fits into wherever you are across the nation, your location. So from the very north point of Alaska is 1,100 air miles to Juneau, which is the capital. And it's 586,000 square miles and over twice the size of Texas. So I think this is kind of a very powerful image of just the scope of Alaska, and it informs very much the work that Anna and I do as far as getting information out to Alaska state residents. This is the University of Alaska Anchorage, kind of our campuses. Our main head campus is located where we physically are located, Anna and myself. We are at the Anchorage campus, which is the University of Alaska Anchorage, but there are 4 other outreach campuses besides the main campus. So there is the Mat-Su College, which is north of us, Prince William Sound, Kenai Peninsula College, and then Kodiak. And so all of those combined is around 19,490 full-time equivalent students. It's about 8,000, and those credit hours are about 237 credit hours.
So, and just to give a little sense of, how the University of Alaska fits into the state, yes. It's a part of a system of universities: University of Alaska Anchorage, University of Alaska Fairbanks, and University of Alaska Southeast. And these are all separately accredited institutions. So while they're under this UA system, they are all separate and separately accredited. So for more information about UAA in terms of student demographics and other interesting things, you can go to the UAA Factbook or UAA Facts, and I have included those links here. So if you're curious to know some of the specifics, we do have an interesting student population here that tends to be a bit older than in a lot of states. We have a lot of returning students, a lot of distance students. So we do a lot of online instruction as well. So it's just a little bit of a different makeup. So that's reflected here in the fact book. You can see a little bit more about all of that.
Okay, so I'm going to talk briefly about the Alaska Medical Library and some the NNLM outreach grant, just to kind of frame where it is we're coming from before we talk about the misinformation grant that Anna was involved with. But first, I think, Anna, there was someone in the chat was saying that your audio might be a little bit quiet. I just saw that, so.
Okay, hopefully.
Yeah, and we will present the slides or share the slides after this. So the Alaska Medical Library was founded in 1969, and its mission was to serve Alaska's medical community, to provide trustworthy medical information to healthcare providers and the UAA APU academic community. So we provide services for UAA and then APU, so those two institutions, which are those students, faculty, and staff. And we are involved with all of the healthcare programs, nursing, allied health, public health, and medical, the WWAMI program specifically. We work with health sciences faculty to develop instruction sessions, research guides, and to help students find and use evidence-based resources for their courses. We also suggest literature search strategies for UAA and APU researchers in nursing, medical, allied health, and public health fields. And then for the community, which this slide represents here, we help identify free, reputable consumer health resources for community patrons who contact AML with health-related questions. So we have this dual kind of role here within the university where we serve the students as well as the community members. And then we also try and demonstrate through trainings free, reputable consumer health resources for public libraries, school libraries, and other community venues upon request. We also produce online guides outlining free, reputable consumer health resources. And so this image shows you kind of the scope of where the communities that we serve are located and the challenges that we have due to the lack of road systems. Many of these communities are only accessible via an airplane, so it's very challenging sometimes to get information out to them. And that's where the NNLM outreach grant comes in. This is a grant that is in year 3 of 5. It began in 2021, and it's titled Reaching More People in More Ways. But it's been going on for many years. And the goal of the grant is to improve the quality of life and health for citizens of the state by providing information outreach services to the healthcare workforce across Alaska. Oh, Anna, if you just want to go back one slide. Sorry, I'm not quite done. Sorry, thank you. Especially in rural areas. And this is the type of professional support that can ease the isolation of that contributes to high turnover of health practitioners in remote underserved areas. Most importantly, providing access to evidence-based information that will assist in the quality of equitable patient care, even in locations far from tertiary care centers. So we do engage with public library staff to assist in delivery of trusted health information to community residents in order to promote health literacy. In rural Alaska, public libraries obviously provide a vital link between community and the broader world, often literally, as the public library in many communities is the only place to find a reliable internet connection. That's getting better, but internet is such a huge issue in the state of Alaska. And these goals are carried out through filling article and literature search requests, site visits, where trainings are held to inform healthcare workers and public librarians on how to locate credible health information. Also participating in online grand rounds meetings with hospitals and monthly Alaska Department of Health meetings. So through the pandemic has made online attendance easier, but it's still a challenge for many people to get access to a secure or broadband. So that's something that a lot of the libraries are involved in those projects. You want to forward the slide, Anna, please? Thank you. So another project as part of the Alaska Library a medical library, I should say. Another project that we were involved with was called the Communities for Immunity Grant, and that involved peer leader navigators. This was awarded in 2021 from the Association of Science and Technology Centers, the Institute of Museum and Library Services, American Alliance of Museums, and the Network of the National Library of Medicine. And the goal was to already include our partner, which was the peer leader navigators. And those are, it's an established collaboration that we've been working with to translate and disseminate vaccine information. But those peer leader navigators is an organization that since 2013, we helped train peer leader navigators in finding, evaluating, and sharing reliable online health information. And so that was kind of a partnership that we already established, and we were able to continue that partnership. And what these people are typically people who are already embedded in the community and are part of these. They're able to go out and help people find reputable health information within the community. So one of the projects that we worked on with them through the Communities for Immunity program, or grant, I should say, was the Healthy Kids Beyond the Pandemic. We made a coloring book, and it was translated into, I think it was translated into 6 different languages. And that was distributed not only in here in the library, but also throughout healthcare centers here in Anchorage. And then we made it accessible on Sled, which I'll talk about in a little bit. If you want to go to the next slide, I can talk about Sled, Anna. Thank you. So Sled is the statewide library electronic doorway. And what it is it's a resource that is for Alaskans by Alaskans. And it was developed by the Alaska State Library in 1995 and the Rasmussen Library, University of Alaska Fairbanks, and it's currently supported by the Alaska State Library. Its kind of mission or goal is to be easy to use website that connects people to high quality Alaska information. So it's authenticated by your IP address. You have to be physically located here in Alaska to use it. It's a really great resource that we try to put a lot of different information onto that Alaskans can access. And I think, Anna, I'll hand it over to you.
Thank you. Okay, so you can kind of see how this all leads into the Health Misinformation Mini Grant that we're going to be talking a little bit more about. And a lot of this, of course, born out of the COVID-19 epidemic. I started in the medical library here about a year ago today. So, and soon after I started, a proposal, there was a possibility to send in a proposal for a small grant coming from the University of Alaska Center for Community Engaged Learning. And so the Community Center for Community Engaged Learning is as according to their mission statement, an intersection of student learning, faculty research, and creative activity and community engagement. And so they had announced this grant. It was initially supposed to be 2 separate groups or individuals that could apply for this grant. So the grant would be divided in between these two groups for health misinformation. I applied for that and argued that, librarians, of course, would be best positioned to really address health misinformation. And as a result, they determined that they should, instead of having two separate groups, simply provide us with the entire grant so that we could then divide that between resources. And in our case, that would be ebooks, and activities where we could get the sort of the word out. So you can see here a little section of their grant requirement, which was as a part of efforts to create a healthier information environment in Alaska, the Alaska Health Misinformation Response Project team, where this originated, seeks University of Alaska Anchorage and branch campus faculty for a mini grant opportunity to raise awareness about the threat of health misinformation, particularly as it relates to confidence in vaccination. And that was really the key. This was this is a part of a larger project that's still ongoing, combating health misinformation. And certainly we're also still involved, even though the grant officially ended in June of this year. We're still working to get this information out and to support librarians across the state, as well as the public, in terms of identifying reliable information. Let's see here. Slide. Oops. Oh, there we go. So one of the avenues for getting this information out was the Alaska Library Association. And here in Alaska, our Library Association is very strong. It's very active. It was founded in 1972, and since then, there have been yearly conferences, apart from when COVID, of course, was in effect. Although we managed to set up an online version of the conference, of course, as many of us are familiar with. It seemed like a natural fit, since you can see here, their mission statement is to bring the Alaska library community together through learning, advocacy, and collaborative action. So this whole idea of advocacy and collaborative action was, is really sort of key here, because what I was doing was presenting to my fellow librarians across the state, which includes public librarians, academic librarians, school librarians, and special libraries as well. So that would include archives and special collections, our library, the medical library, and so on and so forth. So in order to talk about these efforts and providing resources that could be pointed to or used in order to deal with health misinformation. So in our conference, so Jennifer joined me in this presentation where we presented the project in general, and talked about some of the resources that we were gathering, and what our plans would be, and if they had questions, if they needed support when addressing these issues in their communities, to reach out to us, and that we can provide additional materials as well. So some of the things that I talked about when engaged in outreach efforts, and which I shared with the librarians during the annual conference, was how do you determine what health misinformation and disinformation is, and providing some really good examples of that, so it's easier for the public and for students to really understand what shape that can take, and what you can do as a librarian or as a member of the public to combat this. So we talked about how librarians can help address this, how we can be proactive, reaching out, providing even just pointing to the resources online, and then where they can go to access this information. And so what we had done was also create a LibGuide for this particular topic. And on the LibGuide, you can access, you can see the titles that we have purchased that are related to this particular topic. And this is also available on Sled, which is what Jennifer was talking about earlier, the statewide library electronic doorway. And so that means that these resources are available more widely than just, knowing to go to the consortium library. You'd have to actually, know that this LibGuide was there. So this way, there's another access point. So they can access this guide through the Sled website. And so hopefully that allows a greater number of Alaskans to sort of get access to the content. So some of the things that we have done and that we plan to do, since this is really an ongoing project, it's not just the lifespan of this is pretty much continuing, ongoing, since the issues have not disappeared, even though the grant project has come to an end. We have already purchased resources, and those are you can see the ones that are currently available on the LibGuide, and it's primarily ebooks at this point. And then I have also provided information literacy instruction around this topic when working with faculty in my area. And of course, those are often people that are already involved in working with the community at different medical facilities. So that kind of gets the word out to the public in a different way too. So we also work with our colleagues to see if there's ways that we can kind of partner. We can present within different parts of our university campus as well, and we're continually looking for other ways to kind of get the word out. So there's other professional development opportunities that can come up, so we're always looking out for that as well. So it's something that we plan to continue engaging with. And here we have an image from the state of Alaska from this summer. So this is the dipnetting that goes on here at the Kenai River, and both Jennifer and I have participated in this. This is something that's really unique to Alaska. We're all allotted a certain amount of subsistence, I guess, fishing. So we go out and we can catch our yearly allotment with these large nets, and you walk into the water with your fellow community members or fellow Alaskans, and hopefully harvest some wonderful sockeye salmon. So in any case, we have a lot of links that we haven't shown you, but I kind of wanted to see what sort of questions there were, and so that we can better respond without just showing you a whole bunch of websites. So I think at this point we can open up to Q&A. I'm not sure how to, let's see.
Well, Anna and Jennifer, we did have one that came in, and this was with regards to the peer leader navigators. There was a question as to were any Alaska Native languages included in the vaccine information translations?
Yeah, I think that's a great question. So this first round that we did with the peer leader navigators, we've mainly focused on the peer leader navigators and their languages that they were familiar with. So those represented, I just had a list here, I brought it up. It didn't initially represent Alaska Natives, but we had Spanish, Arabic, Samoan, and Korean. And we are hoping to do another round where we do take that same coloring book and put it into Alaska Native. So I think the person who asked that is from YKHC, or anyways, I just saw that in the question. So we'll have to chat. From the Yukon. I think I saw someone that asked that question.
And Jennifer and Anna, we do have a question that came up in the chat, and there are multiple components to it. So I don't know if you want to take a look at that and start breaking that apart and answering bits that apply to the work that you've been doing.
Sorry, I'm just reading through the question.
So in terms of, you know, how we interpreted misinformation, it was based on, I'm going to back up my slides here so I can show you a link. Let's see. Oop. Oh, let's see. Don't want to end the show. I want to go back to it. Okay, so the Alaska Health Misinformation Response Project is a big project that UAA has worked in cooperation with the Department of Health, and so so their sort of interpretation of health misinformation is really sort of connected to and really like as a result of the COVID-19 epidemic and the vaccine hesitation. So that's kind of where this all came from. That's the sort of origin of it. So you can see here on their website, let's see if I can, oh, I think I have to start the slideshow in order to get into it. So let me just do that real quick again. Okay, so let me go back to that. There's their website. So this is the sort of the umbrella under which, you know, we're sort of a part of their bigger project. And so find this, you can see here they're looking at addressing misinformation in the community here, researchers, students, public health professionals, working to identify ways to address the spread of false information. And so, and there's a lot of different projects that they have ongoing, but basically that was sort of the initial sort of concern. And so looking at like what the World Health Organization puts out, for example, you know, on this topic. So, and of course, there's misinformation and disinformation. So you have, you know, information that's deliberately, you know, put out there to mislead. And then there's also just, you know, health related information that's just because you're getting so many different things, you know, how do you interpret and maybe just accepting information that's not coming from a reliable source. So, you know, looking at, you know, where does that information originate? You know, what are our trusted organizations that we can turn to look at the sort of the latest information related to, for example, COVID-19 or any other health related information, vaccine hesitancy, and so forth. So that's kind of the background. And let me see here. There's additional resources here that that they have created that, we also have linked to the LibGuide, that are, I think, really helpful. And they have it in various languages as well. So you have information that is sort of easy to sort of point to. And so this is really helpful for librarians, for example, school librarians. They can sort of download, use these graphics whenever they want to. And so let's see here if I think I have this on a different page, but if I just kind of zoom in, you can see, look, so investigating the source, finding better coverage, so you need to look at, additional sources rather than just relying on one source. And who's behind the information, looking for things like that. So the sort of things that we as librarians do for almost all information that we point to and talk about. We talk about, the credibility. We talk about, the purpose of the information. How accurate is it? Is it complete? So looking at those sort of basic facets, behind the information that people encounter having to do with health information. Jennifer, did you want to add something to that? I'm not sure if I responded fully, but
I can't think of anything. I think that's great.
Okay. We update our guide regularly, our live guides. So that's one way that we keep things updated. And we, because we're a part of this larger group, we look to them as well. Since they're also affiliated with the Department of Health, there's a lot of different pieces in place. And we work together to try to ensure that the information is as updated as possible. And also providing contact information. So people can easily get a hold of me if they have any questions about the information that they're seeing, if they aren't sure or need additional assistance, for example, putting together something that they want to talk about in their community or at their school, they can turn to me and ask for help with that. So those are some of the ways that we're ensuring that that this information is trustworthy, reliable, and up to date. Does anybody have any additional questions? I'll also show you, let's see here if I can. It's always one thing looking at it when you're not presenting and another when you are. So trying to get back to, I think if I close this out. Okay, there we go. So this is the Alaska Health Misinformation Response Project that put out this grant proposal through the Center for Community Engaged Learning. So that's kind of the structure of the grant, and it was at the University of Alaska Anchorage. But it is, as you can see here, it's a collaboration between UAA and the Department of Health.
And Anna, I wasn't able to pull up that website. Do you have the URL that you can drop into the chat for it?
Yes, let's see here if I can. I think I might have it on the previous page. Oops.
Oh, there we go. Somebody else has got it.
Okay. Oh, someone's faster than me. Okay, good.
We did have another question that came in, and that is asking, how are you tracking engagement with the resources in the collection and their impact on the communities?
Well, we're going to be, I'll be working with the larger grant organizer to gather that information. But at this point, it's been, who have I talked to? So, since it's been only a short amount of time since the actual physical or ebooks have become available. So that I don't have that information yet, but we can track some things through Sled in terms of how often things have been accessed. And so they're very interested in collecting that information through the Alaska Health Misinformation Response Project team. They want to know, who did I talk to, and what the nature of that was. And then, we can get some of that information for the resources a little bit later on in terms of the ebooks and how often our guide has been accessed through Sled.
And then we have another question asking which division of the Department of Health collaborated with you on this project?
Oh, they did not collaborate with me particularly. So they collaborated with this larger project that I am not, an organizer of. So I'm not a principal investigator on this grant. I received a small grant as a part of their efforts. So the Alaska Health Misinformation Response Project team worked with the Department of Health. So that's a good question, though. What part of it? I am not entirely sure. I can certainly find out and, get back with that information.
Yeah, I'm not sure if was DHSS, which is social services, or public health. I'm not quite sure.
Yeah.
And Alyssa Portwood pointed out in the chat about the Alaska Health Misinformation Response Project's graphic on Googling like a pro. And I keep wondering, you mentioned that so much of Alaska has a huge internet challenge. So what other approaches are you taking to addressing health misinformation when you don't have web access?
Yeah, that's a good question as well. And we do travel a fair bit. We've been up to Fairbanks and talked to folks up there. Jennifer's been to Juneau, and was it Sitka as well?
Yeah, Sitka.
Yeah, and so we as a library often travel to some of the areas of Alaska, some more remote than that at times. So that's a way that we can kind of be in touch with people across the state by visiting their medical facilities and
public libraries too. Yeah. Mm-hmm. Sorry to interrupt, Donna. I was just going to say, yeah, public libraries, and then the public health centers too, which are the Alaska Department of Public Health centers. And I forget how many there are. There's 200, but those are centers that public health nurses work at, and they're in the community. So I've tried to do outreach to them. Either I'm in on their monthly meetings now, so that's good, and those are online. I try to do more travel to do more outreach, but it's challenging because so many people, challenging one because travel is very cost prohibitive, and also because so many people are attending online after the pandemic, and there's, broadband is getting better, but it's not what it should be. So there's just a lot of, we're trying to work out what the best method is. So it's kind of always a challenge. And then also when everyone's fishing and hunting, trying to get into the communities before they go fishing and hunting.
Yeah, that made me wonder about any kind of partnerships that you have with tribal nations there.
Yeah, the Alaska Pacific University, which UAA is the consortium library is partners with, so we serve both institutions. that is in the process of becoming a tribal institution. So I'm hoping to get more into that. More outreach with their constituents. Also, Alaska Native Medical Center is just adjacent to campus, and they are our biggest user for the medical library. So there are a great deal of outreach efforts that are done through them and connections that are made through Alaska Native Medical Center.
Right. Well, let's see if we have any other questions from any attendees. Had a little bit of chat conversation going on. And I don't know, Jennifer and Anna, with the peer leader navigators, do you know if they provided any training for the navigators on addressing health misinformation at all?
Yes, so there is a cohort, and sorry I didn't explain this properly. There's so many pieces to this, but our prior work with the Alaska Medical Library previously has in the past worked with a cohort, an annual cohort of PLNs that are trained specifically on health literacy concepts. And so they've always partnered with myself or my predecessor, Sigrid, and what we do is we are a part of their trainings. It usually takes an actual calendar year, and actually we're starting up next month here with another training where they learn about, Medline or other consumer sites, PubMed, and then they go out into their communities and try and help people. So kind of putting them into those communities and getting the tools, and practicing different scenarios where you talk to other, friends, family members about topics that come up and how to navigate those conversations, kind of doing a role play. We do that as well. So that's something that is a pretty impactful group that's here in Anchorage. I wish it was in every community. I wish it could be in every Alaska community, but it's here in Anchorage. Mountain View, which is a neighborhood here in Anchorage, Alaska, is one of the most diverse neighborhoods in the nation. So Mountain View, so because of that, that's why we have all these different languages. And that's kind of how this whole Peer Leader Navigators group came to be, because of that. So.
Well, I'll have to look up that area in Alaska. It's really interesting. See if there are any more questions coming in.
People are generally very surprised by how diverse the population is here. It is especially here in Anchorage. So I think that's something that is a big surprise to a lot of people outside of Alaska.
Yeah, the public library really does a good job of representing those different languages in their children's section and youth section. They do a fantastic job of having materials available.
Yeah, that's cool. That's a big job.
It's also why it's really nice that here in Alaska we have such a strong library association, because we know each other pretty well as a result. We collaborate and work with librarians that aren't necessarily, like, oh, I can only work with an academic librarian because I'm an academic librarian. We work with each other sort of across the board. And that's a really, I think, very useful way to ensure that we're addressing these issues. So, working with public librarians, school librarians, it's really important, because then you can sort of get a bigger picture. You're sort of engaged in the community much more. They know what we're up to. We know what they're up to. We help each other out a lot, So I think it's a really nice thing. It's partly because Alaska it's harder for us to get out of Alaska to go to conferences elsewhere. So, that sort of created that really strong organization, and, made it a lot easier for us to collaborate, which I think is part of the success of this, is that, we have ways we can easily reach out and just, pick up the phone, or, talk to our colleagues and, say, how's it going where you are? What can I do to help? So I think that's something that's really uniquely Alaskan, and really important for us because we are so spread out as a state.
Thank you for helping us get familiar with how the library services are rolling out in Alaska like that. You got a lot of love for that, for sharing that, Anna. And we did have another question that came in, and it's more focused on Alaska rather than health misinformation, but we'll go ahead and throw this at you. There have been big challenges amongst the community with regard to the people who are unhoused, and with governor suggesting that the people would be sent to the lower 48 or even California. How have libraries been able to respond and support the unhoused and those who need services but have difficulty accessing information and resources?
Wow, that's quite a question.
And yeah, we get a lot here in Anchorage, because actually we have a lot of a population here that's fairly large, that's homeless, and some folks coming from communities outside of Anchorage. So, ensuring that public libraries can assist with accessing information on social services. We definitely are very sensitive to the needs of people that can't easily open up an email because they don't have they don't have a cell phone number to back up their Gmail account, or all of those things that we take for granted that are really big challenges. For the simplest tasks, we don't realize the various steps involved. So at the public library, I know they do a lot of work with, I'm not sure, Jennifer, do you know if they have some sort of social services on site or access?
I believe so. I think that's a new service that they started, and I think they've actually partnered with the university and psychology or social services students or grad students, so that they can get experience being on site and helping and being there as a resource for not only the librarians but the community members too. But yes, it is a huge issue, and that is something that the governor did say. So yeah, we're just there's so many different facets and pieces to that topic. So
yeah.
All right. Well, I am going to just pop up the last slide here with some of the evaluation information for receiving MLACE credit if folks are interested. And we'll just keep the lines open here for a little bit longer, a couple more minutes, if anyone has any other questions for our presenters. Thank you so much, Jennifer and Anna.
Thank you. It's been a pleasure talking to everybody. Thanks for attending.
thanks, everyone.
Thanks for joining us today, everyone.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.